really the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hello, it's Vet Tales.
Good afternoon.
Natalie Keith.
Nails.
Nails.
Josiah Dame.
Yeah, we are veterinarians and we've been doing it all morning.
Mm-hmm.
How was your morning?
Busy, but good.
Yeah, it was crazy. It was fine till like 10, and then something happened.
Yeah.
My wellness was an illness, and my illness was a wellness, and my recheck was a train wreck, and it was
Plus,
Friday.
it felt like it was 5 o'clock, but it was not. It was 10:30 in the morning.
Yeah. It felt like, yes, time had quit moving and moving all too fast at the
same time.
Yep. Okay.
We're doing a topic today that I'm shocked we have not yet done.
I know.
Very shocked.
I know, especially being Oklahomans.
Yeah, Oklahomies.
Mm-hmm. Is that a thing?
Mm-hmm.
Okay. It's histoplasmosis.
Which is a fungal disease primarily seen in cats. In Oklahoma, Texas, Louisiana are like the primary states that we tend to see it.
Yeah.
It's not fun.
No, it's not fun, and it's not, it's hard to diagnose, and once you have it, you feel like you have to treat it forever.
Yep. But sometimes you don't have to. And prognosis can be decent sometimes too, depending on the form that you get. We'll get into that. But yeah, when it's not the classic presentation, which this probably rings true for a lot of things. You know, we've talked about Addison's, the classic presentation versus the atypical. When it's an atypical presentation, you can't miss it. And that can be really infuriating.
Yeah.
So.
Yeah.
But this isn't a cat episode.
Yes.
Primarily.
It is primarily cats. You do see, Vet Tales. A tale I remember of histoplasmosis. Mm-hmm. Do you remember where I'm going? You don't remember yet, because otherwise your face would look different right now. There was this one time where we had this dog. This was back in the old building when you were still a tech, I believe. And her name, I think, was Honey. And she was like 5-6-year-old kind of pitty mix that had chronic weight loss and diarrhea. And which is not usually what you think. Usually we're talking about cats, but this particular dog was losing weight, and we ended up going into an exploratory that you were assisting me with.
Oh.
He now remembers. So,
guys, I have anxiety. Minimum.
Yeah, minimum.
Other things likely. Keep going.
So we basically were in this X-lap, and this dog has enlarged lymph nodes. And so I'm holding up the mesentery so that he can aspirate the mesenteric lymph node to try to, get some cells out and figure out what's going on with this dog, which we did. Punchline, she had histoplasmosis. But in the middle of this, he punches through the lymph node and into my finger.
She's pregnant.
I was pregnant. He made me call my doctor. It was fine.
I just gave her histo.
Listen, that's
not how histo works.
It's not how histo works. But he had anxiety, and so I did what he asked. Also, my daughter's 6, so that was like over almost 7 years ago.
And she's not like a Last of Us hybrid fungal monster.
Right? Yeah, but she seemed fine.
Everybody's fine. So histoplasmosis. So it is a fungal disease. It lives in the soil. Particularly, it likes to be in nitrogen-rich soils, which tends to be soils that have a lot of bird poop associated with them. So
or fat.
Yeah. So, and I'll get into a story in a second, but areas with a lot of bird traffic, dusty, dirty areas. Dirty is literal dirt, not like dirty, but
dusty.
Dusty, which your outdoor cats are going to be going after birds. They're going to be in those areas. And so it tends to be indoor cats can totally be indoor only because they may have been exposed to it, and then eventually it just happens.
Yep.
It's not contagious cat to cat. It's not contagious through inoculating your doctor with it, your human doctor with it.
Outbreak.
Knowledge is power. And it's kind of I tell people all the time, I'm like, you could have a house of 7. They've all been indoor, same litter. One of them gets it. Something with his immune system did not keep that from
It's taking seat.
over.
Yeah.
Yeah. Clinical signs, the most common area of presentation is going to be respiratory in cats. And so you're going to get a cat who's coming in with breathing issues, maybe some coughing. You'll take x-rays. You'll see the pretty classic fungal changes in the lungs. But there's other ways it can present itself. You can get ocular lesions. You can get chronic weight loss. You can get chronic diarrhea, chronic vomiting, a chronic non-responsive anemia. A lot of crazy stuff.
Yeah.
Neurologic signs. Now, if you get those other types, so not respiratory, the prognosis is worse.
Yeah.
It's a pretty good prognosis with the actual fungal pneumonia.
If you catch them fast enough.
Yeah.
But they still have to be treated for approximately ever.
I have a couple where I usually just tell people, hey, like, this is a fungal disease, but let's all just kind of think of it like a cancer, because that's like an easier
way to think
about it.
Because it becomes almost a management.
It's a management, and it's a remission and a relapse, and like those types of words are used. And so I usually just sit cat owners down who have a respiratory that are slam dunk, and I'll be like, okay, we're going to go on this antifungal. I'm going to repeat x-rays over the next 6 months. I'm going to see you a little, quite often. Eventually, we'll come off of the medication when I feel like we are managed. And then
we'll watch you like a
hawk. And then if your cat's acting weird, it's going on an antifungal.
Yeah.
And it's in remission per se, because it's not necessarily going to go away. Plus, what I find is the most frustrating thing with the respiratory histoplasmosis cats is not necessarily the fungal disease, but the scarring that occurs.
Yes.
That alone, like the scarring that's left from the fungal disease, can be bad to the point where it causes like a chronic
bronchitis type, almost like asthma type cat.
Yeah.
But then you're terrified to get into steroids ever to relieve them of their fungal.
Because steroids can suppress the immune system and then make the fungal worse.
Yep. Yeah. So those are really tough type ropes to walk when you get in this. Not my favorite.
No, mine neither.
Our groomer had one chronic respiratory cat forever and ever when we had grooming.
Yeah.
She still has the cat. She's just not our groomer now.
Yeah. And there's some people who opt to like have oxygen cages in their house.
Yeah. Because if they get stressed, they can flare and things like that. But yeah, it's a lifelong management for sure.
Yeah.
You said you had a tail.
I did. So respiratory, most common. When they come in, we're going to take those x-rays. We're going to offer the histoplasmosis antigen test, which is a urine test.
Isn't that weird? Like, who was the brilliant person was like, wait, I know. What if we look for the antigens in the urine?
No, Dr. Hansel check at OSU had something to do with that.
No,
I don't know.
I mean, they're so good at stuff like that. Their research lab
made that test. But there's someone that was at Oklahoma State for a very long time, Dr. Hanselcheck. He's done so much histoplasmosis research, and now he does it a company, like with a company. He's not at Oklahoma State anymore, but he's still doing it.
Interesting.
That's his whole
life career is
fungal.
This one fungus. I mean, I'm sure he probably dabbles in others. But
yeah.
Histoplasmosis is by far the one we see most of here.
Yeah. The downside of that test, because we always offer it, but the downside of it is it's super expensive.
Like $400 or $500. I mean, that's here. I don't know. Like, we don't get into pricing much on this show just because there's so much variability depending on which labs you're contracted with. Do you get deals? Blah, blah, blah. So if you're a veterinarian charged you more than that, it's not necessarily because you were overcharged. It can be because that we have special deals with IDEX to run things on and can get discounts that aren't always available, or vice versa. Someone else may have a way cheaper version because then they have a better deal. I don't know. Yeah. But they're no matter which way you shake it, they're very expensive. And it does for one thing.
Yeah, that's one thing. And it is going to give you a number, which when you are treating those respiratory cats, you will sometimes monitor that number and try to get it to zero. And then you can kind of manage treatment protocol using that. Financially, a lot of people are like, hey, we can't do that. And then I go, okay, well, the lungs look this way. It's likely fungal. Let's treat it. And almost always it does tend to respond, which is nice. But we always offer gold standard, which...
Well, and the time when that test is absolutely critical is when a patient's atypical.
Yes. So your chronic anemia patients, your chronic weight loss patients, they're just not thriving good doers.
And you can't find cancer somewhere else. You have no other reason.
Feline leukemia, FIV test is negative. You're going to send that test off.
Yeah. I had one, I know you also have a tail, but I think it's a tangent one.
Mine?
Yeah, totally a tangent.
It's a Texas one.
Which mine is too, technically. So I had this cat named Samson, and he was a stray that the mom had rescued. And yes, all of her cats are rescued stray, and she has several. But this has been many moons ago, probably 10 years ago, and he kept getting chronic recurrent hepatic lipidosis with no really other clear answer. And so what that basically means is he would go off food, and his body would mobilize fat, and his fat would get clogged in his liver, and then he'd get sick. And he just wouldn't eat. And so we'd fix him, and be like, "Whew, okay, that's great." And then 2 months later, he'd do it again. The third time, I was like, "This is stupid." And I had ultrasound at him, and I knew he had a nodule on his spleen. However, I wasn't too worried about it because he wasn't a spring chick by any means. He might have been 8 or something. I don't know exactly because he was a stray. But I wasn't too worried about it, but I knew it was there. Then he kept getting sick, and I was like, you know what? Let's send him off to refer and see what they say. So they ultrasound him, and they're like, he's fine. He just has a splenic nodule, and it's like, no big deal. And I was like, okay, well, but what then?
What's going?
So then he got sick again, and I said, enough. And so I made Tracy, Dr. Trussell, take him to surgery, and we took that spleen out. And we sent it off. And you know what that nodule was? It was a whole little package of histoplasmosis. And so he wound up in a research study program at OSU and was on antifungals forever and ever, lived to be a very, very old cat.
Yeah. Dr. Hitchcock probably was doing that study.
That makes a ton of sense now that you're saying it. So, but anyway, yeah. So histo can do some really weird things.
Yeah. And then my weird case, and it was in Dallas, which Dallas proper, we did not see a lot, at least my clinic did not see a lot of histoplasmosis. And it was the first year that I was practicing. And there was a very nice client who lived near the lakes that I worked at in Dallas. And she had a huge duck and peacock population on her property.
Oh, yeah.
And she had quite a bit of property, and she even had pond and things like that. So she had a huge bird population, and then she had a lot of cats. And her cats have gotten mycoplasma numerous times, and we knew that about her property. And so she brought this cat in, a poor doer, just kind of unthrifty. And then I did my blood smear and did everything, anemic. And I was like, okay, anemic, this owner, wonder if it's mycoplasma. So I started my mycoplasma treatment because I didn't see anything on blood smear. And in that particular clinic, I was sending out the CBCs too. And so I sent it out. They're like, no, nothing really. You can test for mycoplasma XYZ. But I was like, let's go ahead and do the treatment. So I started the treatment with some steroid and an antibiotic that kills the
bacteria.
The bacteria. And came back, and I was like, dang, it didn't change much, but I was like, it's not getting better. And so I sent another CBC off, and they were like, histoplasmosis. They saw it
so
on
they actually
the blood
saw
smear.
it on the blood smear. Interesting.
So at that point, that particular cat did not have the respiratory sign. It had just a systemic unthriftiness and a mild anemia. And that was its...
I didn't realize it was circulating in the bloodstream like that until you told me that story. It's because you can find histoplasmosis just like the dog we were talking about at the beginning. We, after we aspirated the lymph node, we put it on a slide, and there were the histoplasma organisms. It's just that you have to find typically a lesion where they're accumulating, like in the spleen of the other cat, or, the issue with cats with the lung lesions, like the pneumonia, fungal pneumonia, is you're not going to probably be able to aspirate that lung and confirm. So you're treating off of the radiographic evidence and the clinical symptoms.
People to send out the urine.
Ideally. But yeah, it's just so interesting because I didn't know it would just circulate in the blood.
It did. And I think I had it on the steroid for only a week, but that cat had been sick for so long that I think it was about to go more systemic than it already was.
Yeah.
But thankfully, we caught it. I was able to stop the steroids, start the antifungals, and that cat ended up doing really well. And it had to stay on antifungal forever.
Sure.
But yeah.
Yeah, I think that the lesson we're learning today, really, or that we're sending out to the world today is, does histoplasmosis do that? And then you go, it can.
It can. And I have found that in my career too, where I've referred things out and they have found out it's histoplasmosis. And then you're like, okay, I have to in a lot of those odd cases, you do need to bring it up. Definitely in Oklahoma.
Yeah. Oklahoma is one of the hot spots. And we also, like, not to tangent too far off histoplasmosis, but we also get pitheosis, which is a terrifying fungal infection that infects dogs. And we get it not too infrequently here. Blastomycosis, I've only seen one of. I think it's more deserty.
So Blasto, and I may be getting them because they're all regional. I believe Blasto is Ohio River Valley. And so I have seen Blasto when I did a internship at Purdue University, and theirs is dogs respiratory.
Interesting. Yeah, and the only case I had seen was a chronic skin. And then Cryptococcus is the other. Cryptococcus in cats is so cool. We have it here. I've diagnosed it here. Several cats. Not in probably 5 or 10 years, but like, which makes me sound like ancient. You know, like 30 years ago when I was first diagnosing cats. But no, like probably the first 5 years when I was in Shawnee, I saw several cases. One of they get this really classic bump on their nose, and it just looks like Liam Neeson maybe, if you will. And then, whom I love, for the record, great actor. I will not be watching his new movie. I will not do it. I can't do those types of comedies.
Oh,
it's like
with Pamela Anderson.
Is it? I don't know. I just seen the previews, like where
it's a TV show. I think.
I think it is a redo. It's like a spoof thing. I don't know. But yeah, like where he's like dressed as a little girl and then goes and pulls off his mask and it's Liam Neeson. And you're like, this is ridiculous. I can't.
I love his wife, and that makes me sad every time I think about it.
Why? I don't know anything about her wife. His wife.
It's just a veterinary podcast. Liam Neeson's wife was in The Parent Trap. She was the mom in The Parent Trap.
Yeah.
She went in a skiing accident in the 2000s and it hit her head, and she thought it was just a headache.
Oh, no.
She had a brain bleed, and she passed away.
Oh, no.
And The Parent Trap movie, I'm 30, guys. The Parent Trap movie is like a childhood movie.
Yeah.
Great esteem. Like,
so that's a big loss for you. Yeah.
And so I was like, dang, it's a comfort movie for sure.
Yeah, well, now I'm going to look at it differently, knowing that was Liam Neeson's wife. So.
And he hasn't gotten remarried, I'm pretty sure. Like, he loved her. I think her name was Natalie.
Interesting. Okay, well, something to research later.
Sorry, guys.
Where were we at? Oh, Cryptococcus, Liam Neeson knows. Here we go. Also, they will get swollen joints. And so you can aspirate the joint fluid and actually find it. The reason I love fungal infections that are localized like that is because they look so cool on cytology, and you can easily identify them. You know exactly what they are, and you have a diagnosis right there for the owner with like one little needle poke.
Yeah,
which is great. We believe it or not, that is what we would like to do. Is do one needle poke on your pet and have a clear answer.
That's treatment plan. My literal dream every day.
Every day,
I immediately get the answer.
Yeah, I think that would be better than dogs and cats that could talk.
Yeah.
Because they would just like not know what to tell you that was helpful anyway. They just like, my joints hurt.
Well, and then really, like, guys, I really just to level with y'all, when we don't know the answer right away and then you find out later, and like histoplasmosis, when it's the normal presentation and then you get the abnormal presentation and it might be a little too late to maybe save the pet, that's awful.
Oh, God, yeah.
Will make you cry. And
lose sleep and question your career choices.
So, a couple months ago, I had one of those cases, and it's hard when you're like, dang.
Well, in the rearview mirror, it's always easy to go, oh, okay, well, that makes sense. But give me a list of things that cause chronic anemia in cats. Go. I'm sorry, we don't have enough time. There's none of that.
So it's.
And you can't just send a $400 test off on every cat that has anemia. Yeah. People would kill us.
It's tough.
Yeah, so you need a crystal ball.
Yeah.
Really, or a really patient owner. Or sometimes just luck.
Yeah.
Like just the blood smear that they happen to see the histoplasmosis on.
Yeah.
So we lose sleep over this disease and Addison's.
And
French bulldogs. They keep us up. They're nightmares. I've been dreaming about the Thunder a lot lately. After every game I watch, the basketball team. Yeah, I like stress with them a little bit. Yeah.
Stresses are warranted. Okay, guys, this is not an NBA podcast either, but are like the NBA finals, like, do they want to go to Game 7 because they make more money? Because
no, he just dropped a conspiracy theory.
But listen to me. The Thunder is a great team. How are we under 30 points for a whole game against the Indiana Pacers when we like ruin them the games before? Guys, I'm sorry.
And what's sick about it is if we'd have just won the first game, that one that they lost at the buzzer.
I know.
None of this would be an issue.
None of this would happen. We need a win in OKC.
We really do. Listen,
I want to go to the...
We are going to talk about veterinary medicine, but I will just say that I started watching a documentary about when the Chicago Bulls became like a well-known franchise. They were nobody until Michael Jordan, and like how they built that is just so fascinating. I was like, we are on the precipice of being the next Chicago Bulls and the LA Lakers. And
well, like my childhood was the New Orleans Hornets came to Oklahoma City after Hurricane Katrina. I went to so many of those games, and then when we got the Thunder, like we were all like, and then Westbrook, and
I know
we're ready.
Well, and I played basketball in high school, so and that's all we did. I grew up in the middle of absolutely nowhere, and we bled basketball.
That's the best sport for middle of nowhere.
Yeah, it really is.
It is
just the sound of the tennis shoes squeaking on the court. And the feel of the leather as the beads go across your finger when you pull it to stop in your hand.
And I hope y'all are watching the WNBA because the Indiana Fever stuff is crazy.
I've seen some clips. I have.
It's phenomenal.
It's nuts. Okay. We digress. This is what happens when you leave Dr. Dame and I unattended. Okay, so histoplasmosis, we are treating it with antifungals, which I don't know we actually said what they're called, but typically itraconazole, fluconazole, last line might be ketoconazole. Fluconazole is the one I use most typically, but I think itraconazole
is
gold standard. Yeah.
It does, again, sometimes become a financial.
Yeah, the financial end of that is what kills you, and the formulation is sometimes difficult. So you do what you can, and you are not at risk for, as we talked about, infection from your animal. So
tried and true.
Yeah. We checked. I'm here to happily report.
I inoculated, Doctor.
Oh, gosh. That was a great day.
But, I mean, fungal disorders, I'm anxious. Again, guys, come on. I tell clients when I diagnose this, I'm like, listen, like, this is kind of like a cancer. Fungal diseases are terrifying because of the longevity of them and the sneakiness of them. But yes, itraconazole is gold standard, and then fluconazole is kind of the second line usually. And then supportive care. So if we're diagnosing a patient with a respiratory illness who's coming in and we're starting our antifungal, they may need to be hospitalized. They may need bronchodilators. They may need secondary antibiotics because they've gotten a secondary infection. They may need oxygen therapy. Like we talked about, some people have oxygen cages at their houses for some of these patients because they can't necessarily keep them hospitalized on oxygen. So a lot of people are like, it's going to be cheaper if I just buy an oxygen cage, and they do it.
If they're super bad, sometimes you have to actually do IV antifungals for a few days, which we used to there for a while. Again, this has also been probably 10, 15 years ago. The puppies coming from the shelter in the city were having just massive outbreaks of fungal pneumonia. Like, I don't even understand.
It happened in Dallas too.
Did it?
Yeah.
Okay. Yeah. Well, anyway, so we got really good at hospitalizing those guys, but I haven't seen that in a long time.
Yeah. And then once we get them to a stable place, they're at home, they're on their antifungal for 3 to 6 months. That's when you're going to start. If we're able to do the urine antigen testing, gold standard would be to serially. Thank you.
Oh, that's brutal.
Serially.
I got it that time.
Captain Crunch monitor it until
or fruit.
You can
rather
to decrease the antigen concentration after about 4 to 8 weeks of treatment and then you will treat 30 days after a negative.
Yeah.
If people can't do that, then we'll treat until we feel comfortable. We'll come off and then we'll watch like a hawk.
Yeah. Sometimes like the respiratory cases, you can monitor radiographic changes. The ocular ones, you can see the fungal ick on the back of the retina.
Oh, yeah.
And so you can actually monitor those as well by just looking at the retina, which I had a cat case that we've been monitoring. It was actually Dr. Goodall's case moons ago. And she just came in for her recheck because she was starting to flare again. It was like, whoop, okay. She'd been off antifungals for probably close to a year. And she's like, hey, she's starting to do that thing again. And
start prescribing that medication again.
Yeah, and then we're going to start prescribing that medication again. And so we did. And so I haven't actually seen her back for a recheck yet because it was just not too long ago. But anyway, so yeah, it's just you're constantly monitoring clinical signs. Whatever the cat or dog started with as signs, we're going to continue to monitor for that after you stop the medication to make sure you don't see them coming back up.
Yeah, yeah. And then just to quote the VIN, which is the Veterinary
Information
Network, humans can be infected with histoplasmosis. I guess
yes.
you did not know that. But
you don't catch it
there's no direct
yeah.
transmission between dog and cat. However, transmission through inoculation is possible through from animal to animal, not necessarily human.
Interesting.
So
I
had every right
to be panicked.
Scared.
Well, I mean, it makes sense. Inoculating does make more sense, but as long as a person's immune system isn't compromised at that time, then theoretically that little guy should just get zapped right off.
You were pregnant, so I had every.
People are like, what was she doing in surgery? It's a long story. It's fine.
You were wearing it.
I was doing all the proper PPE. It's fine. Yeah. One of my good friends from vet school has, since she graduated, worked at a spay and neuter clinic during all three for pregnancy. Mm-hmm. Never. That's actually an interesting topic that I shouldn't. I'm a man. Shouldn't be, but every doctor I've ever worked with pretty much has done surgery through their pregnancies. They wear those big respirator masks. So. Yeah, and then of course, everybody should have the proper ventilation systems and all that, the escape stuff. But wow, I feel like we took tangents to the next level today.
We did. But do you guys like them?
Yeah, listen, here's the thing. We could use some feedback. I'll be really transparent with you. If you're still listening, you've earned it. Some people absolutely hate the fact that we kind of bounce around through a topic. It drives them nuts.
Really?
Yeah, they're like, it doesn't feel like you have a plan. It's like we're reading off a piece of paper. Like we have an outline. We went through what is the disease? Why are we concerned? How do we diagnose it? And then what's the treatment plan look like? Right? What else do you want from me? What do you want from me, blood? A little bit of a Little Shop of Horrors for you. I like to quote that one, not infrequently. Anyway, so we could use some feedback on what you do or don't like about the podcast. Do you feel like we're covering these topics well? What would you like to see more of? And just as a small teaser, we're discussing the possibility of having Q&A sessions or at least pre-recorded questions. And I have one of our drug reps, I think, that's going to come on soon. I say drug rep, but it's actually a laboratory at X Labs. So just for extra super detailed, fun, nerdy stuff about tests and why we do them and how they do them. So just some fun new stuff because we've covered a lot of topics in the past couple of years. And so we're branching. But feedback, we love it. But if it's not good feedback, could you say it nicely? Sandwich it with a nice thing and then the constructive thing. And then another nice thing, because we're very sensitive people in the veterinary industry.
Before you know it, this podcast's going to be a sports conspiracy theory. A
sports conspiracy theory with a therapy off-brand.
Yeah.
It's just a little bit of John Deloney thrown in there for you. Okay. All right, people. I can't anymore. That's all I got. I can't think of any one more helpful thing to say. So the three things we want to cover again is who is this for? This is for all dogs and cats that are in the Oklahoma area and that similar pathway. Do you want to broaden that statement?
Yeah. Cats with respiratory illnesses, dogs with respiratory illnesses, cats who are chronically having kind of not doing well, weight loss, GI signs, big breath, chronic anemia. It's for those kitties.
Yep. And so just let us know if you have any concerns like that. We always try to keep fungal on the radar, especially when nothing else obvious is the cause. If you want some more information, you can get some really great client handouts from BCA's website.
You can also get them from VIN Veterinary Partner.
VIN Veterinary Partner is a great one. Yeah, those are some websites you can trust to not steer you wrong. Don't just Google it. And please, for the love of butter, do not get your veterinary medicine from Facebook. That's your PSA of the day. I appreciate y'all for listening. And if you have another topic you want us to cover, give us a shout.
Go Thunder.
Oh, go Thunder. Bye. Bye.